Whether we're talking about socialism or its evil twin, fascism, and there is a difference, of course. Socialism is where the government owns the means of production, whereas fascism, like corporate fascism, is more the public-private partnership where government basically controls private industries that actually produce the goods and services. I like the quote from Winston Churchill, what he had to say about socialism. He had, and I quote, he said, "Socialism is a philosophy of failure, the creed of ignorance, and the gospel of envy. Its inherent virtue is the equal sharing of misery." And that pretty much says it all. Both AAPS and the Eagle Forum have fought this battle for freedom before. In 1943, when AAPS was established, it was the Wagner-Murray-Dingle bill that AAPS was involved in fighting against. Fast forward about 50 years, in 1993, it was the Clinton Totalitarian Health Care Plan. And as many of you know, AAPS filed a lawsuit in that case, AAPS v. Clinton, a lawsuit which we won, that fought back and exposed the things that were going on behind closed doors that they were planning for the citizens of this country. Now here we are in 2009, and it's just like the evil bunny of socialism. It just keeps coming back and coming back and coming back. And indeed, there are socialist politicians who have told us that that is exactly what they had planned. And just like the deception and fraud of socialism itself, the current so-called health care reform legislation has more to do with government gaining more power and control over the lives of individuals than it has to do with actual medical care itself. So with the various bills pending and hundreds of amendments to these bills also being considered, what's the word of the day? Compromise. Well, what does compromise mean? Well, in the healthcare arena, in healthcare legislation, it's akin to basically debating how much cyanide is acceptable to add to the Kool-Aid. If you look at the U.S. Constitution, the words healthcare, medical care, and medicine do not appear anywhere in the U.S. Constitution. Our government is in fact, you're right, our government is in fact not authorized to practice medicine or to interfere in the practice of medicine. And we've been down this road before. We've heard some of these same claims and promises before. When Medicare was being debated in 1964, for instance, we heard that it was going to be low cost. In his Great Society speech, President Johnson predicted that it would be very low cost. And in fact, the current cost is about $108 billion per year. They also promised no government interference in the practice of medicine. In fact, you can look it up. It's Section 1801 of the Social Security Act. And I can't read it from here, but you can read it there. It basically promises that government won't interfere in the practice of medicine. It won't dictate the terms and treatments you can and cannot get. And it also will not fix the prices that people who provide medical care are allowed to charge. Basically, they have broken every single one of those rules, and government now interferes in nearly every aspect of the practice of medicine in Medicare. There's something like about 130,000 pages of Medicare rules and regulations, and of course there's a price-fixed fee structure now which has become problematic. People were also told that they could keep their own insurance if they liked it, same as they're being told now. In fact, it was Section 1803 of the Social Security Act that guaranteed that if you wanted, there was nothing in this new legislation which would prohibit you from going out and purchasing your own private health insurance. But what happened, of course, was that the government program destroyed the private insurance market. Now, even if you wanted to, you could not go out and buy private insurance past the age of 65. It does not exist. It's also important to note that coverage is not the same as access. Telling people we're going to have universal coverage and cover you all is not the same as access to actual medical care. If coverage were the same as access, we would not see Canadians coming across the border in droves to get medical care when they need it here in these United States. And believe me, there are some Canadians that are frightened what will happen to them if we adopt a system similar to theirs. Cost is also not the same as price. You can fix the fee or the price for an item, but you cannot change its cost.